Sjögren syndrome, that's how you say it. But what is it? April is Sjögren Syndrome Awareness Month. As of 2016, it's estimated that 4 million Americans have this condition. Most of them are women, and there is no cure. If you've ever heard of Sjögren's before, then you probably associate it with symptoms of dry eyes, dry mouth, fatigue, or joint and muscle pain. Maybe you know that Venus Williams suffers from it. Well, Sjögren's is an autoimmune, inflammatory, connective tissue disease that is known for attacking moisture-producing glands all throughout the body. That means that the person's body is attacking its own joints, muscles, skin, blood vessels, and other organs, much like occur with RA or lupus. But their system is also attacking various glands all throughout the body that are supposed to secrete substances to keep us healthy. The lacrimal glands, for example, produce tears for our eyes. Without adequate tears, the eyes can itch, burn, and become red and painful. This can make simple everyday activities such as reading or watching TV very difficult. Vision becomes blurry and the eyelids can actually stick to the eye. Without a protective tear film, the cornea can become scratched or even develop ulcers or tears. It's also much easier for eye infections to develop. The salivary glands secrete saliva into our mouth. Saliva helps us talk, chew, and swallow. Can you imagine how your life would change if you suddenly had trouble talking, chewing, or swallowing? Saliva also coats and protects everything in the mouth. Without it, ulcers and infections can occur. Gum infections can destroy the jaw and contribute to tooth loss. It's not uncommon for people with Sjögren's to end up with dentures early in life. Another important role of saliva that you probably don't even think much about is that it starts the process of digestion by moistening and breaking down food in the mouth. Without it and other substances that are supposed to be released all throughout the gastrointestinal tract, it can become hard to digest and absorb nutrients. This can lead to numerous complications, including malnutrition. Other glands that are destroyed in Sjögren's syndrome include those that produce sweat on our skin, which helps with body temperature regulation, and those that produce oils onto our skin for moisture and skin integrity. Without these protective substances, the skin can peel and crack easily and develop sores, rashes, and infections. Mucus glands help lubricate and protect the respiratory system and aid in air exchange. Without these glands working correctly, sinus and lung infections are common and it can make breathing difficult. Sjögren's is such an involved condition that I could go on and on about how it affects the body. But the main things I want you to take away today are that it's very prevalent, it's very similar to RA and lupus, often having features of both. It affects the entire body, and it mostly affects women in what's supposed to be the healthiest years of their lives. They often look completely normal on the outside, but their bodies are under attack from the inside, causing great pain, discomfort, and disability. Symptoms also tend to wax and wane very unpredictably and with great variability. This results in periods of really bad, debilitating times mixed with periods of improved function. Now, this was meant to just be a brief introduction to Sjögren's, not a comprehensive review. Please help me out by listing in the comments other things that you know about Sjögren's. If you have Sjögren's, then let us know how it's impacted your life. If you don't have Sjögren's, then please let us know what questions you have about it. And don't forget that you can always find more information on the Sjögren Syndrome Foundation website. The biggest thing that everyone can do is to help spread awareness. Awareness leads to quicker diagnosis, research, understanding, and hope for better treatments or maybe even a cure. Please share this video as widely as you can.